Welcome back to Your Health Matters. I'm Peggy Pico. It's one of the happiest moments of your life, welcoming a new life into your family, but it's also one of the most unpredictable.
I've actually always gone a little early, so I wasn't too surprised when I went into labor early. I went into labor on a Saturday night, and I just knew that it was going to happen that night.
Shannon Santos' youngest son, Joey, was born preterm, and even though he was a healthy weight for a preemie, his lungs were still underdeveloped. He was going to require some special care.
And when he was born and they said his weight, 7 pounds 3 ounces, I was so excited. I thought, perfect, he's good size, he weighs a lot. And then after I was holding him for a little while, they took him from me because he wasn't breathing that well. And that's when they told me that he was going to be here for a while.
But fortunately for Joey, Eden Medical Center is equipped to handle these special cases.
In some babies, especially I think like baby Santos, who are slightly premature, but their lungs might be slightly immature, and so they need additional respiratory support.
Hi.
Dr. Tammy Wang treated baby Santos in Eden's neonatal ICU.
If you have prolonged periods of time where you have low levels of oxygen, you can have organ failure, so your heart can be damaged, your liver, kidneys. And in addition, the brain can be damaged.
Joey was able to receive the needed medical care quickly and without having to be transferred to a different hospital.
With CPAP, we were able to do that for baby Santos. So CPAP stands for continuous positive airway pressure, and it's a type of ventilation that it provides a continuous flow of pressurized air to the lungs. Prior to the CPAP program developing here, these babies, if we couldn't just support them with nasal cannula, we had to transfer them to a different hospital. And I think the hard thing about that is it separates the mom and the baby, because mom is here recovering, and baby's now at a different hospital, and you kind of lose that chance for the initial interaction in the first days of life, which can be really, really important. Did you hold his hand yet?
Dr. Wang is a pediatric hospitalist, a relatively new position in hospitals, but one that makes Eden Medical Center stand out from others.
Hospitalists are physicians who only care for patients when they get admitted to the hospital. So a pediatric hospitalist is a pediatrician who just cares for patients when they get admitted. So here at Eden, the pediatric hospitalists, we go to deliveries, we resuscitate the babies and provide help if they need it right after birth. And then we take care of babies in the NICU. And we also will see patients in the emergency room here at Eden when the emergency room staff ask us to consult on these patients. And I think part of the reason why that's beneficial is because more and more people realize that children aren't just small adults, and they have problems that are unique to them and ways of treating them that are kind of unique to pediatrics.
The care and attention patients receive here are part of a bigger picture, one that reassures patients that the care they receive at Eden Medical Center is full service from your very first appointment on. Isn't that just the cutest? Dr. Wing mentioned that, of course, separating the mom and baby, nobody wants to do that. What is it about Eden that is making it possible for moms and babies to stay together there?
As Dr. Wang mentioned, we have the hospitalist program in pediatrics, and that's made such a big difference because what it's done is it's elevated the level of care that we can offer to these babies. What's special about the hospitalist program is it ensures that we have a doctor on site 24 hours a day, 7 days a week, every day of the year. Therefore, as she said, every delivery is attended by a pediatrician. And when problems arise after delivery, a pediatrician is right there on the floor available to care for that problem.
And time is such an essence with newborns. I mean, this is, a matter of a minute or a couple minutes can make a huge difference. I noticed that you also had some beds there for babies that did have some problems. So you actually do have some people who can help if a newborn infant runs into trouble.
Yes, definitely. Eden has a level 2 nursery, and what that means is we're able to care for not just well babies, but babies with problems such as jaundice, babies that have infections, and therefore we can administer antibiotics. We can use feeding tubes. We can, like Dr. Wang said, give respiratory support in the form of CPAP. And
so whatever their needs are, as soon as they come, you can handle it right there. Wanted to get one quick question in and have you answer this. When a mom is looking for a hospital or a doctor, when they're pregnant for the first time, give me just a quick few tips of what they can do to find their doctor, find their hospital.
Okay, first of all, if the mom isn't already attached or already has a relationship with the obstetrician, the first thing they need to do is, look at where they want to deliver. Check that hospital's website, check out that hospital's reputation, then look at their list of available obstetricians. Once they get to that list, one tip I always give my patients is actually call the labor and delivery nurses, because they know the inside scoop on all these different obstetricians.
Absolutely, they do. I was a labor and delivery nurse. I can vouch for that. Well, when we come back, we'll tell you about a condition that most women have and don't even know about it.